Good morning, afternoon, or evening, wherever you're watching this from and whatever time you're watching it. So today I'm going to present to you the course Anaesthesia and Intensive Healthcare. So this is my plan. I'm just going to make a small introduction of myself, what is anesthesia and what to expect in Morocco, and some general advice. So my name is Candice Nakanyike. I graduated from the Superior Institute of Health Professional and Medical Practitioners, called ISPITS in Rabat, as an anesthetist in the year 2019-2020. Okay, so I'll give you a brief or a short definition or description of anesthesia. So what is anesthesia? Anesthesia is the condition of not feeling pain, especially by the use of special drugs. The drugs used to block pain are called anesthetics, and we have different types of anesthesia. Anesthetists therefore care for patients before, during, and after surgery. Technically, the life of a patient on a surgical journey depends on the anesthetist. Anesthetists equally have intensive care roles in the intensive care unit. So that's just something you should know about anesthesia. Anesthesia is just simply feeling numb. Yes. Okay, so what to expect in Morocco if you want to do anesthesia? So anesthesia is a 3-year course taught in the ISPITS, and the ISPITS are found in different towns such as Rabat, Casablanca, Fez, Oujda, Agadir, Tanger. Yeah. And so during the 3 years of your study, you do both practical and theoretical learning. So in short, you work both at the hospital and classes. Yes. So the first year is mostly about basic general nursing information. The real work starts in the second year when you now specialize more into the real anesthesia and intensive care work. So it's in the second year we learn more about the types of anesthesia, how they work, how to care for patients throughout the surgical procedure, and most importantly, we learn about the different anesthetic drugs, how they work, and the risks they can cause during and after an operation. Yes. So in Morocco, anesthesia is performed as a team. Yes. So we have anesthetic doctors, anesthetic nurses who work together. So if you are to study in Morocco and anesthesia, you're going to be called an anesthetic nurse, infirmier anesthesia. Yeah. But I wouldn't really describe that as, but the case is different when you go back to Zambia. Yes, and I'll answer that during the question and answer session to give you a brief definition of the difference or what you expect, the difference to expect during your study in Morocco and Zambia. Yeah. So as you can read on, if you decide to study anesthesia, this is what's expected of you. Getting the patient safely through the whole procedure, monitoring vital signs, yeah, providing care for the patient to prevent the pain and distress they would otherwise experience during the surgery. Okay, for me personally, anesthesia is I call them drug dealers because mostly you work with drugs which numb people. Imagine you're about to go for an operation and you need, we know operations are surgical procedures. They involve opening up of the body and different things. So that's the help of anesthesia, to numb you, to make you sleep, so to say, during your operation. And when you're sleeping, or once the drugs have been, anesthetic drugs have been administered, you can't control your body organs or functions such as your breathing system, your heart rate. So that's the work of an anesthetist, to control such things, to make you sleep and control them. Yeah. So like my general advice is, I believe many of us came with the mentality of studying medicine, but what happens if you don't get it? Does that mean you change your field of interest? I believe, personally, I don't think so. Yeah. There are many other medical courses which have not been labeled as medicine that we can always branch into. Yeah, and for me, it's important to always ask the right people for information about the course you wish to pursue. Find out everything. They're always there to help you. Well, anesthesia generally is a good course as any other course. So no one should feel that doing a low-grade course just because it's not medicine. But everyone has to keep in mind that it's a very prestigious course. And trust me, the job market in Zambia is very high, because I recently learned that anesthesia has just been introduced in Zambia in some certain universities. And generally, Zambia lacks anesthesists. So yes, that's my brief introduction about anesthesia. I hope to meet you guys on a Q&A. Yes, and feel free, ask questions. Thank you for your attention.